Waiting to go live. Waiting. Am I live yet? I think I might be live now. What's up, everyone? My name is Jocelyn Conley, founder of the Vagina Doc, a pelvic floor physical therapist in Arizona. And who on this live, or if you're watching this live, comment live. If you're watching this on the replay, comment replay. And my question to you guys is, have you watched Athlete A yet? Athlete A is the Netflix documentary on USA Gymnastics, and particularly about the abuse and the cover-up, or mainly the abuse that Larry Nassur, the USA Gymnastics team physician, had put the abuse on him to the athletes, and them coming forward, sharing their story. The reason why I wanted to talk about this is because someone had reached out to me and asked me if I watched it, and just thanking me for helping her, and asking if any pushback, if I've gotten any pushback based on what I do on that documentary, because that documentary it's disgusting, and it could imply things that are not true about healthcare and pelvic health rehab. So if you have watched Athlete A, and I will admit I've only watched part of it, I haven't watched the full thing yet. Basically, what Larry Nassur did was he used his power as a physician, as a healthcare provider, to manipulate these young athletes into thinking that what he was doing was essential for their performance and they needed it. And, from what I did watch, I didn't see like the consent process. I didn't see as much like, what's his process beyond like, oh, to move the coccyx, I have to go rectally. And it was so disturbing, you guys. This is not rehab. And those girls were so young and they had no understanding of what was happening, that is straight up abuse, and that is not what goes on in my world. So what I do as a pelvic floor physical therapist, pelvic health physical therapist, is I help women overcome issues like urinary leakage, pelvic pain, back pain, issues related to loss of pelvic organ support, kind of like a hyperextended knee. The back of the knee is stretched out, while in pelvic organ prolapse, often the ligaments that are suspending the organs off of the vaginal walls are stretched out, or the pelvic floor muscles are weak. And I help them do that so they can get back to life their sports, without their symptoms limiting them. And my approach is such that more on the education, so it doesn't happen, and then the prehab around that, and then the rehab, and then the performance side. How we do that is through different First thing is I get your story. Second thing is, based on your story, I form a hypothesis and decide what I'm going to do in my exam, depending on the time that I have, and then review a treatment plan and say, hey, this is the option that you're going to get to your results the fastest. This are the risks of selecting these treatment approaches, and these are the benefits of the treatment approaches. And I have the patient, I ask the patient if they have any questions, and we choose the plan together. And then I say, this is about the timeline for this is the timeline for that. And if the patient or client is under 18, there is a parent, and typically there is someone in the room if they want, like, depending on the therapist's structured. Not always is there a chaperone involved, but if there is any question, if that person, the patient, cannot understand the consent process, then there has to be a chaperone. And with Larry Nassur, there was not. There was no consent process at all. So let me just tell you a little bit about our exam process. I'm only going to go into a little bit detail because I do have a podcast on this. It's with it's with Pelvic Boxer, if you guys follow her on Instagram, and her name is Jenny Lacrosse. And her episode is What to Expect Your First Pelvic PT Visit. I believe it's episode 10. And Real Talk with the Pelvic Docs podcast. I'll put the link in the comments. So I watch you move after I get all of your history, and then based on your movement and your symptoms, I say these are the best exam techniques. Sometimes that involves an internal exam, and what that is I'm going to read you the statement that goes along with this. This may include palpation of the area that is most direct and accessible. If done, this is through the vagina or the rectum with gloves on. So if you're having pelvic pain or urinary incontinence or prolapse, then I want to assess the structures, the muscles mainly, and the muscles that have the nerves and all of that. And one of the entrance points is either through the vagina or through the rectum. This is a common approach with pelvic floor dysfunctions, including pelvic pain, urinary or fecal incontinence, pain with intercourse, pain from episiotomy or scarring, vulvodynia, vestibulitis, so inflammation of the vestibule, which is part of the vulva, or other similar conditions. Also, that can include hip pain, that can include back pain, depending on your history. Now, the consent process. I understand the benefits of this procedure will be explained to me. I understand that if I am uncomfortable with this procedure at any time, I will inform my therapist and the procedure will be discontinued and alternatives will be discussed with me. This direct pelvic floor procedure, assessment procedure, utilizes myofascial release principles, entailing the relaxation and lengthening of the muscles and other tissues involved with the pelvic floor, sacrum, which is the bony part of the pelvis, coccyx, which is a part of the bony pelvis, coccyx bone. This technique is accepted physical therapy technique as indicated above. Our experience has demonstrated that this direct pelvic floor exam and subsequent interventions are helpful, often facilitating consistent therapeutic results. As with any other area of the body, most people require a series of specific treatments. Now, this statement was another part of this consent is internal examination of pelvic floor muscles is consistent with physical therapy practice. It complies with national physical therapy policies requiring the performance of tests and measurements of neuromuscular function as an aid to the evaluation and treatment of a specific medical condition. The statement was adopted by the Executive Committee of the Section on Obstetrics and Gynecology of the American Physical Therapy Association. And the point is, like, a lot of those girls were so young. They had, how many of you look at your informed consents that your doctor has given you? A lot of you don't. And for me on this topic, I'm like, did you read the papers? Do you understand this process? Do you understand that if there is trauma that you've once had in your life that you haven't really faced, this could trigger that trauma. And I am only doing this because I think this is going to help your goals. This is directly related to your goals. What he was doing was so wrong. And so I don't want watching that video, that documentary, to give you this false impression of pelvic health physical therapy. Because what we do, what trained professionals that don't use power or manipulation on our patients, we really offer life-changing interventions that don't include medications or surgery. I mean, I was watching that video. I was so disgusted by his just overall like creepiness. And I get it. Like, okay, when he was talking about the tailbone thing, yes, that a lot of gymnastics injuries and a lot of gymnasts leak urine. But that is not, no way that he should have been doing what he was doing. Like, that was so messed up. I don't, like, kids are a no-go zone because I don't think they really understand and are fearful of of what could happen if they do tell someone. I mean, oh my gosh. I really hope that this was helpful if you have watched that and you're like, well, why is this girl called the vagina doc? Why is this girl saying that this is what she does? Well, I've spent so much time in training on this, and I know when it's not appropriate and when it is appropriate. And really, my goal is to spend the least amount of time there as possible, because when I leave, when you're not with me, there's only so much, like, you're functioning in your life. So I want to improve your function and not, if that makes sense, like improve your movement if that's impacting, say, if you're leaking. Although, as a lot of you know that have worked with me, that's like, we have to do some pelvic floor work. But as soon as I can empower you to do it on your own, that's what we do. If you want more information, I'd love for you to check out my podcast, Real Talk with the Pelvic Docs. Check out episode 10 and episode 13. Episode 10's with Jenny, who talks about the exam process. Episode 13's with Dr. A adolescent physician who specializes in gynecology, and she talks about her exam process. That is key. Getting informed consent is key, you guys. If you have any questions, please place them in the comments. I don't know why I can't see any comments if they are coming through. If you're watching this on the replay, please comment replay. This is super important. I mean, I'm dedicating my life to this, and I do not want I don't want people to get freaked out because of a creep like Larry Nassur. And just understand that this happens not just in pelvic health. I mean, this happens in a lot, like manipulation, using power to manipulate happens all the time. And that doesn't mean all the people in that domain are bad or creeps. It just means that that person is a creep. Thank you guys for watching. I hope you have a wonderful Monday, and I'll see you next time on Real Talk with the Vagina Doc.